All right, this is a very interesting situation. 14 years of headaches, brain fog, difficulty concentrating and focus, feeling like your head is compressed with a hockey helmet and a vice, tension headaches, and you've gone to every doctor that I know in the field. You've been to the experts that I know. Let's start with, well, you had the styloid removed. Can't get real close here. So you have the styloid removed. Your right jugular vein is your primary dominant vein. So you had the styloid removed, and then you also had the transverse process shaved down a little bit to try to get this jugular vein to open up. And this is your jugular vein as open as it gets. And it still looks like it's under tension being pulled across there. It's not optimized. But we're done with surgeries on that side. Now, the styloid on the left has remained, and you can see how it is definitely active. And as soon as you go into, let me get that external carotid out of the way. As soon as you go into flexion, this left jugular, and let's just say this left jugular is responsible for 15 to 20% of your venous drainage, you're still not out of the woods. So we want the good doctor, actually Dr. Osborne's going to remove this styloid, open this up, and that way you'll be able to bring your head down, at least not shut down that jugular. Now, the other thing is that you've lost your curve in your neck, and it does not seem to come back. We even put a weight around your neck to try to bring the curve back. It did not want to come back. And here we found this hyoid is back in between the internal carotid and external carotid. And the hyoid attaches to the skull and is keeping it from going back into extension. So the two traumas that we're looking at, we're looking at the result of two traumas. One, where you went through a gully and your car went up 20 feet in the air, and then you landed, putting an axial load through here. We'll show how that played out, a whiplash. And then the other trigger is that you went to a chiropractor that pushed your atlas forward from behind, trying to put more motion in it. And once he pushed you forward, you're already kind of stuck forward, and you haven't been able to come back since. That's really what we're trying to antidote. So a couple things we did today. Well, we pulled on this hyoid, and the cricoid of the thyroid cartilage is twisted sideways too. So we popped and cracked and pulled all that contracture out, and you felt a lot better. And as soon as we pulled all this out, and we see this with whiplashes where the anterior compartment of the neck will suck back, the muscles will contract. So once we pulled all that out, you immediately were able to release, and your head was able to go back, and your natural positioning was more into extension. Then, well, the other thing is these first ribs down here. You can see how this first rib is pretty much coming off the facet and 50% off. We did not adjust this today, nor did we go after that one, and that also happened from the trauma, we're from that car accident. We're going to say that. Right, so the force that went this way, we came in today and we adjusted you from the front. We pushed the atlas back. We went up under the jaw and moved it back. Now C2, let me see if I can demonstrate to what's happening mechanically here. Your C2 is actually stuck kind of in flexion and pushing the atlas forward. So think of C1 and C2 kind of acting together. So we went in under the jaw and pushed that back. Now there is another anterior atlas adjustment where they go in through the mouth, neurological organization technique and DNFT. They get on the anterior tubercle and they push the atlas back, and it pushes that C2 back. We didn't do that today. We can do that another day. It's a good adjustment to see how that works for you. Now what really did help you today also is that when we adjusted the atlas from the front on the left, so we prioritized this left jugular vein, and again we act like C1, C2 moved together, and we'll we have to show up another video where C1 and C2 were fused together, and we did the same adjustment on them that we did on you, and the whole thing shifted back and straightened right up. But we adjusted primarily from the front to open up that jugular vein, and that is what made you feel better. Actually, you felt so much better with everything we did, pulling the hyoid out, pushing the atlas back to antidote the force from the chiropractor, and then adjusting the atlas from the left anterior, prioritizing the compression of this jugular. Now here's where it gets very interesting. This is what the x-rays look like, the atlas orthogonal x-rays. Now the doctors you've gone to have been adjusting you from the right. And I can tell you, this is what we want to see. People that do in my field, we want to see a real high plane line on one side. That way we don't have to worry about it being on the opposite side. So when we see a high plane line, we think, great, we have all the data we need to know that we have to adjust from the right in this case. And we measure the ACD, that is 3.41 degrees. We draw a line through the center of the skull, line through the center of the atlas, and we see it's at an acute angle of 3.41 degrees. That's a lot. So we feel confident we can adjust from the right, except that didn't do anything for you and didn't help you. And that's been done by several doctors, and what's supposed to work doesn't work. So then we did, actually we'll show you really the in-depth study that we did at the cervical cranial junction. Long story short is we found that there's an offset. So think of it as though, well, the C2 facet on the right, it is higher, and the load comes up through your neck, primarily on the right side. You can see the odontoid is offset between the skull and the atlas. The whole thing is slid to the side. So I already knew that the odontoid is not in the center of the foramen magnum. And here I use this as, anyway, this is the line of force coming down from the weight of the skull. This is the line of force from the neck. There's an offset. So the question is, does this offset, can the center of the foramen magnum being offset be more important than a high plane line? So we ran the experiment today and adjusted you from the left, which would be anathema to a lot of doctors until they saw the CAT scan that we did today, and then they would understand. But we adjusted you from the left and from the front, and you were set free more than you've been in years.
Years, yeah. Correct.
Right. So experimentation beats theory all day long. So let's show you what gave us the boldness to go after this. All right, so here we can see there's a beautiful shot of the styloid. Here's a beautiful shot of the offset that in this case was a stronger hand than the plane line. Here's a beautiful shot of the hyoid going in there, the crooked thyroid cartilage. Your first ribs come down. Now these first ribs have scalene muscles that attach, and when we see ribs like this, there's a bobblehead. Those stabilizing muscles aren't able to modulate correctly. So that's what that picture shows. Again, there's your jugular. There's a beautiful shot of how screwed up the first ribs are. Great shots of that non-dominant jugular. You were born with a vascular anomaly, the way the blood drains out of your head. Beautiful shot there. Okay, here we go. These are the alignments. So I drew a line through the center of the foramen magnum, and then we started adding the atlas to it, and this inferior facet of the atlas on the right has gotten way larger than on the left. I wanted to draw a line through here, but it would not be accurate because the line of force is coming up from through the neck on the right side. It's offset. There's an offset. So just picture the supporting column being on the right side of the neck, and then you coming off your car going 20 feet in the air and then landing, and the weight of the head and the atlas came down and collapsed on the right. So when we see those x-rays, you think, oh, we have to adjust the atlas. The atlas has gone up to the right. No, it's collapsed on the left. The whole supporting structure collapsed on the left, and that's where we're seeing this offset. And look how much larger that facet is, because it's having to, just like a boxer that uses the right arm to box with, more than the left, his right, all the bones, everything will get larger and adapt to that. So you're like that. All this has gotten large and adapted to the forces going through there. So any lines that we would draw through there are not exactly accurate. Yeah, okay, this is where the transverse process was shaved away to open up your dominant jugular. There it is, still entrapped on that side. And not to mention, when you bring the atlas down, that styloid is subluxating the atlas, and going to be very hard to hold an adjustment. So Dr. Osborne's going to help us with that. This is the 11th picture. Beautiful shot of the styloid. crooked thyroid cartilage, hyoid digging in between the internal jugular. Oh, and by the way, carotid. The internal carotid and external carotid has a plexus of nerves around there that do not like to be touched. Oh, and the physical exam today. So before we did anything, we started just poking on you. And as soon as we put any pressure on there, your arm went weak. There was a dysautonomia coming from this location. And the other thing is we pulled the atlas forward a little bit just to see, and it turned your lights off and made you go weak. So the exam confirmed everything here that we saw so far. Yeah, this is this vascular anomaly you have. This is the way the transverse sinus usually goes. You have this extra little vascular drainage, and that's the right internal. That's the right jugular, actually right jugular foramen. That's where it goes into the jugular vein. And the left side is not dominant, but it is responsible for some. And when they did the pressure gradient on there, when they did the manometry and ran, they saw that they said almost nothing was coming out of this side. Well, yeah, because it was blocked. And if they waited long enough and put more contrast through like we did, they would see that it is still responsible and patent. And there's a vertebral artery that came across that might be it's not really a bad dolichoectasia. Okay, so let's see here. There's that offset. Okay. So when you turn your head to the right, the odontoid stays butted up against the right lateral mass. And also when you turn your head to the left, it's the same thing. It pretty much stays there. Your skull does rock up to one side with right rotation, and then with left rotation, it does go a little bit the other way, but not so bad, not so much. Really, you can see how that odontoid is sitting there. So our current working diagnosis, again, was that it was more of a collapse on the left side than the atlas riding up on the right side. Anything you want to comment on? Anything I might have missed? Anything you want to say?
Well, I do feel lighter, and my suboccipital muscles are much more relaxed now and aligned. My head feels lighter.
Than any of the other atlas adjustments that you've had?
So far, it's yeah, it is.
Okay. Experimentation beats theory all day long.
Yeah.
Okay.